Being gluten-free is sometimes seen as a fad or a health craze, but in patients with celiac disease, it's serious business. Celiac disease is a chronic autoimmune disorder that affects the small intestine. The immune system of these patients reacts abnormally to gluten, a protein found in wheat, barley, and rye, causing inflammation and damage to the lining of the small intestine. Now, when a patient with celiac disease eats foods containing gluten, their immune system causes damage to the tiny finger-like projections called villi that line the inside of the small intestine. This damage can make it difficult for the body to absorb nutrients from food, leading to malnutrition and a range of symptoms. What's tricky is that it's the immune response and not the gluten itself that causes the damage. This is why a tiny amount of gluten, anything above 20 to 50 milligrams, can trigger a significant response with significant symptoms. For context, the average American consumes around 20,000 milligrams of gluten a day. Symptoms of celiac disease can vary widely and include abdominal pain, bloating, diarrhea, constipation, and fatigue. You may know people who don't have celiac disease but get these kind of symptoms from eating gluten. This is called non-celiac gluten sensitivity. We diagnose celiac disease based on blood tests looking for antibodies and an EGD to visualize the small intestine and take biopsies to look for inflammatory cells at the microscopic level. But non-celiac gluten sensitivity is diagnosed based on a patient's symptoms alone. The only treatment we have right now for celiac disease is a strict gluten-free diet. This means avoiding all foods that contain any amount of gluten. Avoiding gluten is very important for patients who have celiac disease because if they eat gluten, they'll develop low blood counts, vitamin D deficiency, malnutrition, and be at increased risk of small intestine cancer and lymphoma. Non-celiac gluten sensitivity doesn't carry these same risks, but avoiding gluten helps these patients feel much better. Let me know if you have any questions in the comments and tell me which disease I should discuss next.